A 24 years old female present or referred to acute surgical team as she is noted to have absent left radial pulse. Apart from the dizziness and lethargy, the patient does not have any feature suggestion of the acute limb ischemia. So, and the blood test, it reveals sodium 136, potassium 4.1, urea 2.3, creatinine 77 micromole per liter, ESR 66. What is the most likely diagnosis? So here only the ESR is increased, other parameter normal. And in case of the female patient who is 24 years old, suddenly present with the dizziness and lethargy, and on examination there is absent left radial pulse. So what may be the answer? Here the options are the Turner syndrome, Takayasu arteritis, Kawasaki disease, coarctation of the aorta, breast carcinoma with a local spread. So what may be the options? First of all, let's see the Takayasu arteritis. What is the Takayasu arteritis? It is a large vasculitis. That means it typically involves occlusion of the aorta by inflammatory procedure, and it is the present with the absent pulse. So when there is the absent pulse, and it occurs due to inflammatory occlusion of the aorta, and it is more common in female and Asian people. So this point is very important. The Takayasu arteritis, it is the inflammatory condition. It usually occurs in case of the female and usually in the Asian people. And what are the association of the Takayasu arteritis? The association of the Takayasu arteritis is the renal artery stenosis, and the management is the steroid. So steroid is the management of the Takayasu arteritis, and it is associated with the renal artery stenosis. And the inflammatory obliterative arteries affecting the aorta and branches, that means the large vessel. So it is very important, and female are more affected than that of the male, and the symptoms include the upper limb claudication, and the clinical feature present the diminished or absent pulses. So when there is upper limb claudication and on examination there is absent pulse in case of the upper limb, then it is diagnosis in favor of the Takayasu arteritis. ESR is also affected. So keep in mind in three form. First of all, upper limb claudication. Second of all, this diminished or absent pulse, and third of all, the ESR increase. When these three parameters are identified, then directly go for the Takayasu arteritis. So what is our answer? Our answer is the Takayasu arteritis. Why Takayasu arteritis? Because there is the absent radial pulse, dizziness and lethargy develop, and there is the ESR increase. So when there is upper limb claudication, absent upper limb pulse with ESR increase, go for the Takayasu arteritis. Thank you all. Other option here such as the Turner syndrome. In case of Turner syndrome, the other, as it is the genetic disorder, so other feature are also present. Kawasaki also not this condition, and in case of the coarctation of the aorta, usually ESR not affected, and in case of breast carcinoma, actually the breast carcinoma, the vessel involvement is very rare and extremely late.